From consultation fees to the cost of tests to treatment and then medication. Before you know what's happening, something as simple as a hospital visit has turned into a serious financial commitment. Hello everyone, I'm Miberon Omoloju and this is PolicyWatch by PolicyTV. So why is healthcare so expensive? Let's break it down. In Nigeria today, about 70 to 75% of healthcare spending comes directly from people's pockets. That means when you are sick, you are mostly on your own financially. There is no strong system cushioning that cost for you. In fact, over 90% of Nigerians pay for healthcare out of pocket with very little insurance coverage. So before you even think about treatment, you're already thinking about money. Now, compare that to countries where the system actually works. In many of those countries, healthcare is supported by insurance or government funding. So when people fall sick, their first thought is not, can I afford this? It is simply, let me get help. But in Nigeria, it is the opposite. Now, why exactly is it like this? First, government funding is low. Nigeria has consistently spent far below the 15% budget benchmark for healthcare. So, hospitals are underfunded, and when hospitals don't have enough support, they have no choice but to pass that cost to patients. Secondly, health insurance is still very limited. Nigeria introduced the National Health Insurance Scheme in 2005. Now known as the National Health Insurance Authority. But till today, only 5% of Nigerians are covered, and most of them are in the formal sector. And what happens to the majority of Nigerians who are self-employed or work in the informal sector? They are left out. And that means instead of sharing the cost across the system, everyone is paying individually. Now, even the little insurance that exists is not fully trusted. Some providers complain about delayed payments, sometimes months late. So, in some cases, insured patients are not even treated with urgency. And at the same time, many insurance plans only cover basic care. But once it becomes something serious like surgery, cancer, or trauma, the burden still falls back on the patient. So clearly, the system itself is weak on both sides. Then there is the issue of drugs. Nigeria imports over 70% of its medicines. So when the naira drops, drug prices go up, and once again, the cost comes back to you. Now, when you put everything together, low government funding, weak insurance coverage, high cost of drugs, you end up with a system where healthcare is not just a service. It becomes a financial risk that has real consequences. People delay going to the hospital. People try to manage symptoms at home. People turn to pharmacies first because they are trying to avoid that immediate financial pressure. And by the time they finally go to the hospital, it is often more serious than it should have been. Now, when a system runs like this, where payment is required upfront, care slowly starts to shift. Hospitals begin to depend on who can pay immediately. So sometimes paying cases get prioritized over urgent cases because the system itself is built around survival. So what is the way forward? Nigeria needs to fully implement and expand a working national health insurance system that actually reaches everyday people. It has to go beyond government workers and cover people in the informal sector, small business owners, artisans, and everyday Nigerians. Insurance only works when it is not limited to a small group of people. It has to be something that millions of Nigerians are part of. Also, enrollment has to be simple, affordable, and accessible at community level. Government has to step in and properly subsidize it, especially for low-income households, so that nobody is excluded because of money. Then there is the issue of what the insurance actually covers, because right now, many plans only cover basic things, like consultations, minor treatments, and so on. But once it becomes serious, like surgeries, emergencies, long-term illness, the patient is back to paying out of pocket, and that defeats the whole purpose. So coverage has to be expanded to include things like emergency cases, surgeries, maternal health, and chronic illnesses, because those are the situations that really push people into financial crisis. And then there's awareness. A lot of Nigerians don't even fully understand how health insurance works or why it matters. So there has to be consistent public education at the community level, explaining it in simple terms. Now, our healthcare should not depend on whether you have money at that moment. It should be something we all can rely on, especially when your life depends on it. And that should be the goal. Thank you for tuning in. I'm Miberon Omoloju, and this has been Policy Watch. Goodbye.